What's happening?
What changes? I mean, what? This is like the fourth session.
Okay.
Apparently, I didn't expect this much to happen this soon. But a lot of changes. I mean, I joined my gym after like 3 years, which was me actually going and paying the fee would have been a big thing. I've been feeling better, and I'm driving good. I feel positive. Usually, like in midday, to like 1 or 2, I'm like finished because it gave me so much fatigue. No, it's like 5:30, quarter to 6. Might just hit the gym on my way back home and I go. Yeah, it looks positive. I feel younger, to be honest. I mean, that's a major change because I'm like what, 38. I won't boast that much, but I feel 30ish. So yeah, that's cool.
The pain is one thing, right? So the pain is
no, the pain is going gradually.
good.
But the emotional effect it's wonderful. I don't know how it's happening, but it's good.
I want to hear this because I mean we see this on a day-to-day basis and we specialize in that.
Yeah.
It's great to hear some of the more deeper effects that are happening. You know, just
I'll tell you what is happening. See, I've been living with this thing for almost 12, 13 years now, right? And when I come for a treatment and within like 4 sessions I feel that brighter, and obviously it has a big emotional impact because you don't expect things to happen. I mean, get fingers crossed to happen that soon. And these things you can't do it yourself. And I am somebody who is so against medicines, so against the shots and all. I mean, been there, done that. Honestly speaking, I was a little petrified about this this treatment, but then again, it's not painful, it's not invasive, it's wonderful. I mean, the emotional effect along with the physical is wonderful. Improve my posture. I feel brighter in the morning when I get up. Usually, after a night's nap, you tend to feel fresher. Around a week back, I used to feel like I should go back to sleep again because I never used to feel fresh, but now I just get up.
Wow. You came for some pain relief. Would you say that these are added bonus? Did you expect these changes or?
No, not at all. I thought, because I had gradually started making myself believe that okay, I'm aging, which probably wasn't the best thing to do, but barring the condition I was in, I mean the situation, the scenario, the pain, the fatigue, the disorientation, there were so many things along with that, so obviously I had to go with the flow and I was like, okay, and I kind of gave up. Well, you sir, you got some blessings from across the globe, I guess.
Thank you, sir. You sitting here and you telling me in detail, it just reinforces why I do what I do. And that, first of all, have I given you any medication?
Nothing at all. Just your bare hands. So far, just your bare hands. I have seen stuff here, but you haven't used that either.
It's it's a process. And have I spent long with you?
No. Do you want me to? Okay, so 4 sessions. What? Besides us talking, I think we've done more of talking and less of involvement in terms of time. So I guess what, 10-15 minutes in totality?
In totality, right?
Yes.
I mean, and I explained that it doesn't take long.
Yeah.
After one has gone and been assessed, and we've done our imaging to determine and locate the problem areas. Exactly. I did explain it doesn't take long to apply. Of course, the skill is in knowing where to apply that pressure. And when we've made that correction, that adjustment, provided we can get good movement in the spine, it's like my job's done. Now it's your body from the inside.
Standing up straight I mean that's a big thing.